Let's talk about the glomerular filtration. So that's the first step of the urine formation. So let's review the urine formation, like the basic steps. So the blood is entering the glomerulus through afferent arteriole, and then going to the glomerulus, and from there to Bowman's capsule, and from there it goes to the tubes. That's distal convoluted tubule, proximal convoluted tubule, loop of Henle, distal convoluted tubule, and the collecting duct. And from collecting duct, it's going to the renal pelvis, and from renal pelvis, it's going to the ureter, and then to the bladder, and from bladder it goes to the urethra, and from urethra it passes out as urine, where we can see uh, the urine is. Okay, so we are going to talk and to focus in this video about Starling forces. Okay, so how the filtration is occurring. It's also called ultrafiltration. So let's start here. So it is also called ultrafiltration. Okay, and what kind of process it is? It's a passive. It's a passive. It's a passive flow or process. Okay, and also it's called it's called it's like a bulk flow. Okay, so all the blood is coming, and then it is getting filtered, and whatever is not filtered is carried away. So it's a bulk flow, and it is non-specific. It's not bringing something specific for filtration. Everything is coming, but some getting filtered and some is not getting filtered. Okay, so based on that, you know, so we can let's draw the structure of, just for a review of the Bowman's capsule. Okay, okay. So that's fair, roughly the Bowman's capsule, and then we're going to put the capillary network here. So this is the capillary network, and the blood is coming through afferent arteriole. Okay, so let's view which one is it. This is the afferent arteriole. Okay, and this is the efferent, starts with the E, arteriole. So the afferent it brings the blood in, brings the blood in to the glomerulus. Okay, and the efferent it it takes the blood away. takes the blood away. Okay, so what blood it takes the blood away, which is part of which, let's put it this way, part of which is not filtered. Okay, so that's afferent and efferent. There is another major difference between the two, and that's more important to know. The afferent and efferent, they are both the blood vessels. Okay, but the afferent has a larger diameter, and efferent had a relatively smaller diameter. Okay, and I've shown in the picture that the diameter over here, I'll do it in the blue so it's visible, it's smaller. Okay, so and we have to keep that in mind as we understand the process of glomerular filtration. Okay, so that's the basic difference we're going to talk about between afferent and efferent. Now, so the blood is coming from the renal artery, and then it is going through afferent, then it is going to glomerulus. Okay, so the first step of filtration, it occurs, so filtration occurs right here. So we're going to stop right here. Okay, so at the glomerulus the filtration is occurring. Okay, so now glomerular is what? It is a tuft of capillaries. Okay, so it's a tuft of capillaries. So when the blood is entering through afferent arteriole, since the diameter of the afferent arteriole is larger, there's a lot of blood is entering there. Okay, and then the diameters get smaller in the capillaries, and it's further reduced. I mean, if you compare the diameter between afferent and efferent, the efferent has the less diameter, so that causes a resistance of blood to flow towards the efferent arteriole and then go towards um, the peritibular artery. Okay, so because of the resistance of flow, there is a pressure buildup. Okay, so right here in the glomerulus there's a pressure buildup. Okay, in the glomerulus. So I'll just point it right here in the capillaries. Pressure buildup in glomerular capillaries. So this is the pressure. This pressure we call it hydrostatic hydrostatic pressure in the capillaries or of the capillaries. So let's put it in the capillaries. So this hydrostatic pressure is the driving force for filtration. Okay, but this hydrostatic pressure is this hydrostatic pressure we talked about. Sorry, this hydrostatic pressure is opposed by two pressures. Okay, and we're going to talk about it. So let me first draw the filtrate in the Bowman's. This is what the Bowman's area. Okay, so or Bowman's space. So I'm going to mark it like that, Bowman's, because it's important to, we're going to talk about it. Important to know Bowman's space. Okay, so let's write down. Let me write down um, the Starling forces. Then we can talk uh, in a little bit more details about it. Okay, so let's try to write it right here. That's J. So V equal K F H P C minus P I minus pi C minus pi I. Okay, so that's the formula for the Starling forces, and we're going to talk about it, what it is, so you can understand the filtration. Okay, so JV, what is this? This is the net filtration. This is the net filtration. Okay, that's an R. So net flow. Okay, so and KF is what? It is the vascular permeability coefficient. Okay, and then HP sub C, it's what is the capillary hydrostatic pressure. I'm just going to put HP. Okay, that's hydrostatic pressure. And what is P sub I? P sub I is the capsular hydrostatic pressure, or you can write as interstitial hydrostatic pressure. Okay, and then pi sub C, pi, we denote it for osmotic pressure, so that's the capillary There's the capillary. Oncotic is for the proteins and oncotic pressure. Okay, and pi sub I, let's write it down so you don't get confused. It's what? That is the interstitial, is interstitial, what pressure? That's the oncotic pressure, because the pi is oncotic pressure. Okay, so now we'll define what is what and how we calculate it. Okay, so we already talked about the pressure buildup and the hydrostatic pressure in the capillaries. Okay, so that is that HPC, which is about, let me write it, change the color so I can, it's more visible. So that's about 55 millimeter of mercury. Okay, so that's the hydrostatic pressure in the capillary, the pressure buildup, because the blood is going in a large volume here and from the afferent arteriole to the capillaries, and then it's not able to escape quickly, so there is a pressure buildup. Okay, and that's the pressure is driving the fluid down. Okay, so that's the capillary pressure. Now the capsular hydrostatic pressure, the interstitial hydrostatic pressure. This is the pressure that is created. This is usually, it's about, I would say, probably 15. Some books it says 10, some it says 15. So let's put it 15 millimeter of mercury. So that is, that capsular pressure, hydrostatic pressure is in the capsule. It's like in the Bowman's space. Okay, there is already the fluid there, and that is pushing this structures up, and it's kind of resisting the flow down. So that is what it is causing this. There is a fluid here in the Bowman's space that is pushing it back. So that is trying to reduce the capillary pressure or trying to stop the capillary pressure, whatever way you want to take it. But that's what it is. Now the capillary oncotic pressure. Okay, so capillary oncotic pressure, what it is because of the, because, let's put it in short, because of proteins, some globular proteins that are not filtered. So these are globular as large proteins like albumin. Okay, so that stays in the capillaries. It's not filtered out. Okay, so the concentration of these proteins are high in the glomerular capillaries. So, and in the down, if you see in the Bowman's area or space, there is mostly fluid, that's plasma. Okay, that's more water, because plasma has 95% of water content, and rest 5% is your plasma proteins, and there are some other ions in there. So since there's a high concentration of water, okay, in the Bowman space, and there is less concentration of water in the glomerular capillaries, so there is a development of osmosis or oncotic pressure, We call it capillary oncotic pressure. Okay, so because of that osmosis, the water tends to go back. That there's a, or you can say those proteins are in the glomerulus is trying to pull the water back in the capillaries. So that pressure we call it capillary oncotic pressure, and that's about approximately 30 millimeter of mercury. Okay, now the last pressure. So this capsular hydrostatic pressure and capillary oncotic pressure, they are opposing. This the hydrostatic uh, capillary pressure. Okay, so the hydrostatic capillary pressure is in the downward direction towards the flow of the filtrate. Okay, that's how. And this capsular hydrostatic pressure and oncotic pressure, it's in the opposite direction. It's going back towards the glomerulus. Okay. Now the last pressure is interstitial oncotic pressure. Since normally there are no proteins in the filtrate, okay, in the Bowman space, so there is no buildup of any kind of oncotic pressure. Say if the kidney or the nephron is not working properly, then there will be a lot of proteins in the filtrate. Then there would be a buildup of oncotic pressure in interstitial space, or you can say the Bowman's space. Okay. So then, but since there's almost none, it's almost none. It's not that some small proteins are not present in the urine. Uh, there's a protein, small protein, it's called HCG. That's the protein found when the women are pregnant in their urine, okay, during their pregnancy test. So that's like small. So you can say there's very or little or none uh, proteins in the urine under a normal healthy condition or healthy kidney. So that's so the interstitial oncotic pressure is almost zero. We'll put 0 millimeter of mercury. Okay. So now if we do the math, okay, let's before we do the math, let's define a little bit the K sub F, okay, which is a vascular permeability coefficient. So what it is, it's basically the talks about how permeable is the capillaries. Okay, like in this case, the glomerular capillaries, and the area of or the size or the area of the filtration bed, you can say, because here in this glomerular capillaries, uh, this is a lot more permeable than capillary in the muscle tissue. Okay, because this glomerular capillaries, they have they're in the endothelial cells, because the capillary is made up of endothelial cells, a single layer cells. It is like perforated, as we call it, fenestrated. Okay, so because of this fenestration, this increases the permeability. So that's it depends on the, so it's like, let's keep it like a constant. Okay, so that's more like about talks about permeability of different uh, vascular capillaries. Okay, so if we calculate the net filtration, what we are getting is is basically this, if you calculate, it's 55 minus 15, 55 minus 15 minus 30. Okay, so that comes to what? About 10 millimeter of mercury. That's our net filtration. That's the filtrate. Okay, so that's how you calculate. And the the Starling forces, if the JV or J sub V, if you use whatever you can put it here, the net filtration, if it is positive value, then the fluid is coming out from the vascular network. Fluid out from vascular network. Okay, if this value is negative, then the fluid is coming in. So what does it mean? So if JV is positive, that means there is filtration. If JV is negative, okay, J sub V actually, if the net, if this, because of this imbalance of forces, if the net force is positive, then it's filtration, and if it is negative, then it is absorption. Okay, so that's another thing it's important to know about the Starling forces. And let's talk a little bit about the GFR, which is the glomerular filtration rate. So GFR is, how do we define it? It's in simple language. If you want to define it, it's the amount of filtrate formed per minute. Okay, so GFR is normally what it is. I think it's about 125 milliliter per minute. Okay, so that's the amount of filtrate is forming in both the kidneys per minute. Okay, so another thing I wanted to mention is from this afferent arteriole. I don't have the room to write, but I'll just talk about it. Or maybe I can write down here. Yeah. For the afferent, from the afferent arteriole, 100% of blood, okay, 100% of blood is entering the afferent arteriole, but only 20% is filtered. Okay, that's plasma basically, minus the globular proteins. So 20% is filtered. There's a filtrate. Okay, and out of this 20%, 19% approximately is reabsorbed. Okay, so let's put it here. 100% is coming through the blood vessels, only 20% is filtered, then 19% is reabsorbed. That means 1% is excreted. That's the urine. Okay, so the plasma, whatever is coming, so 99% of plasma is going back to the circulation. So I hope I didn't confuse my listeners, and I hope you understood the glomerular filtration, the Starling forces. And if you have any questions, feel free to post in the comments. In the next section, most probably I'm going to discuss about the reabsorption. Okay, so thank you for watching.